Hello, I am Jonathan Jenkins, and I come from Rock Springs, Wyoming. I am a student physical therapist currently in my second year at Regis University. Some of the things about myself are that I value my family and friends above all else and enjoy fishing and going for hikes on the weekend. A few areas of specialization that particularly interest me are vestibular pathologies, pediatrics, and postoperative rehabilitation. I also enjoy delivering volunteer services to those who are underserved when opportunities present themselves. With regards for my ability to be flexible during clinical education, I am more than willing to work any schedule that my clinical instructor requires of me and can adjust as necessary. I am able to switch between different clinical settings while maintaining a professional therapeutic presence. Some of the strategies I typically use during my clinical experiences to ensure success are to review cases and pathologies before treating the patient the next day, taking the lead with initial evaluations while centering the patient's goals around the plan of care, and prioritizing safety for both the patient and myself. One of the strengths that I bring to a clinical environment is that I am not afraid to ask questions and am an effective communicator with the clinical team. I am able to balance a therapeutic presence while also maintaining professionalism. I provide evidence-based care and feel comfortable working with all populations. Finally, I would consider myself a fast learner and have a strong work ethic. During my DPT education and clinical education experience, I have searched for opportunities to receive constructive feedback by establishing meetings to discuss with my advisors, professors, and clinical instructors about my performance. I see constructive feedback as a way to improve my practice rather than taking it as a negative criticism of my performance. During my first clinical education experience, I discussed with my clinical instructor how I did that day before leaving the clinic, and then would have weekly talks about expectations for the future and how to better prepare for patients to provide optimal care. Some additional preparation I plan to prepare for clinical settings are to take a dry needling elective to be level 2 certified and a Piper pelvic floor course to expand my services. I plan on taking continuing education courses with regards to treating patients with vestibular pathologies. My goals after graduation are to work in an outpatient musculoskeletal setting in a rural community in Wyoming. After years of experience, I plan to establish my own outpatient clinic and eventually become a professor for a DPT program to pass along my knowledge to future generations.